All right, good afternoon, ladies and gentlemen, and welcome. For our first session today, we have a personalized approach to cancer treatment, roadmap of cancer genomic and immunology testing in the UAE. I would like to hand over to Dr. Rawia Mubarak, who will be leading the session today.
Hi everyone, hope you can enjoy the session today. If my voice is not clear, you can use the headset. And if you need the full recorded presentation, you can scan the QR code and we will send it to you. By the way, I'm Dr. Rawia Mohamed. I am the head of Anatomical Pathology at Burjeel Medical City. I'm presenting on behalf of Dr. Faisal Khan. He is the CEO of OncoHelix Collab at BMC. So just a bit of a background about OncoHelix. In Canada is a state-of-art laboratory where all the molecular and genetic testing being done. More than 1 million samples tested and with 350 plus publications in the University of Calgary in Canada, with multiple awards received, like the ASHI. Cooperates with OncoHelix to design the OncoHelix Collab, which was inaugurated last week. We have the official launch of the OncoHelix Collab at BMC, where all the molecular testing being done in-house at BMC. Just let me take you through some of the general goals of the OncoHelix Collab. It's that no patient specimens or data will need to leave the United Arab Emirates for diagnosis or precision treatments. So there is no need for that. Everything is available in this laboratory within BMC in Abu Dhabi, if you don't know where is the location. Okay. Right, for the OncoHelix Collab, basically it's based on 3 modules of precision diagnostics. The first module is the molecular diagnostics. The second one is the cellular immunology module, and the third one is the transplant diagnostics. Let's go back to the history of the molecular testing in a human genome. In 1961, where Watson and Crick discovered the structure of the DNA. In 1973, where Carey Mullis invents the PCR, and initiation of the human genome was in 1990, and by 2012, the sequencing. 2002, the sequencing. As you know, if you pick up 2 persons and you test for the genetic similarity, you will find 99.9% they are similar, and they are different in only 0.1%. And this 0.1% difference can give to 3 million nucleotides difference. And that has a tremendous effect on the genetic variation among individuals. So the patient will have, or a human will have, a different susceptibility to diseases, different immunity response, different action of drugs, and different treatment outcome, and different phenotype as well. So that's why it's really important in personalized medicine to look for any genetic differences among patients. Now, the first module, which is the molecular diagnostic module, mainly will test for the molecular oncology cases. So we have different panels, including soft tissue panel, neurology panel, a breast cancer panel, other solid tumor panel as well, and genetic disease detection at the same time, as well as we have the testing for residual disease monitoring. So that's all will help the oncologists to get, and pathologists to diagnose cancer in certain cases where we will need molecular testing. Let me give you one example. For example, in oligodendrogliomas, we cannot diagnose histologically alone unless we do the 1p19q code testing, for example. Also, that will help in cancer risk classification and identify targeted therapies, for example, like PD-L1 or HER2 testing. Now, again, it's like a three-tier system for the module 1, where a single gene profiling is available, where a single nucleotide variant will be tested. Or we have a wider type of testing, which is a hotspot multi-gene profiling, where we can extend into the copy number variants, or a comprehensive genomic profiling, where it has a wider type of genetic testing to include fusions as well as the microsatellite instability. So for the single gene testing, biomarkers can be detected in about 30% of cases, while 60% will not be detected in such testing. The hotspots multi-gene is basically can detect up to 65% of biomarkers, while the comprehensive gene panel can detect up to 85%. So we do have the three type of testings, depend on the pathology, depend on the oncologist requests in order to proceed with them. And actually, we do have a very good turnaround time compared to all of those molecular tests sent abroad. So we will be able to have lots of biomarkers that will affect the therapy and the treatment of the patients. All of these can be detected. So immunotherapy and chemotherapy can be given on a personalized basis. This approach will help the mission of giving the patient the correct type of treatments, starting with the single gene testing as a tier 1. We can include even wider gene and in a multi-gene NGS, which is more cost-effective and target-oriented, or a comprehensive panel where we can get a wider range of genomes up to 85%. Now, for the first tier and the first panel is much cheaper with a quick turnaround time, 5 to 7 days, while if we compare it to testing being sent abroad, it can take to minimum of 3 weeks to 1 month, while in-house it takes about 1 week only. This is just an example of the first panel we have. It's a targeted panel, as you can see, with a good turnaround time, and even we can do the MRD assay as well. This is one of the studies done in the OncoHelix Canada, where it's 275 cases were tested, patient with acute myeloid leukemia, and with the panel, the OncoHelix myeloid panel being done, more than 90% of those cases have at least one driver mutation, which can be easily detected within 7 days duration. Again, this is the panels that are available currently in-house within the BMC. We can detect different number of genes with different number of alterations, including fusions or even MSI testing. So it depends on which one we are gonna test for. The comprehensive panel, it has advantages. It's allow detection of a greater number of genetic alterations, as I mentioned, allow assessment of biomarker interaction. It's help us with the diagnosis and risk assessments and given the correct targeted therapies, improved outcome as well, and allow better use of resources like tissues, and also it's a cost effective with a good turnaround time. Now, for comprehensive genomic panel, as we said, it can detect a wider range of genetic and molecular alterations, and without the comprehensive genomic profile, we can miss up to 81% of the variants. These are the different methods that we are using, Illumina and some Roche and the Sophia genetics for different panels we have, and it's available in our laboratory. This is just an example of our request form for the molecular diagnostic testing. As I said, we do have a different panels, and it's just a really long test menu for all the solid tumors as well, including neuro-oncology panel, breast panel, prostate and ovarian, lung panel, colorectal panel, and etc. Now that was for the molecular module. For the second module, which is the cellular and immunology testing, again, as we mentioned, it's help with the cancer detection and monitoring, immune disorder testing, and immune function assessment as well. So proud that 37 publications were done for this module, and in different aspects, including the transplantations and the cytotherapy and immunogenetics. Again, an example of the request form that's used for the cellular and immunology module that also include the HLH diagnostic workup. The third module is the transplant diagnostic module, and here HLA matching can be done, graft monitoring as well, and disease association. Again, about 45 publications in this module related to the BMT and the cytotherapy and tissue antigens were done. Don't need to go through this. If you're interested, we can send you the whole presentation. Again, example of the third module of the TRF available here in-house, and we are ready to proceed with the testing. Having all these modules together, the single gene testing, the multi-gene NGS, the comprehensive panel, along with the cellular testing and transplant diagnosis, it helps us as a clinician, as an oncologist, to give the best treatment for the patient according to the unique genetic makeup. With that, hopefully no patient specimens or data will have to leave UAE for the sake of the diagnosis of or precision treatment plan. Thank you very much. If you are interested to know more about this, scan the QR code and we will send you all the details. Any question? Excellent, no question. Yes.
The report that comes at the end, who will be translating this data and give the recommendation to the patient?
Okay, we do have a full crew of molecular pathologists and expertise that's available within the lab. They are the one who will translate the analysis of these genetic alterations and give the recommendations, all within a full comprehensive report from the OncoHelix. Yes, will be done, yes. Yes, the whole thing. A full comprehensive report. Yeah.
Thanks for your presentation. Are you using NGS-based next-generation sequencing-based diagnostic method as a part of your procedures?
NGS-based is used. So we have here our technical staff. As I mentioned, I'm anatomical pathologist. So, doctor, you can answer this. There is NGS-based as well?
Hi, I'm Dr. Ra'izah. I'm from OncoHelix. Yeah. So, yeah, what's the core question? Yeah. Oh, you cannot hear?
NGS-based testing.
Yeah, we are using NGS-based assays, yes.
Yes.
Yeah, here, yeah.
So neuro-oncology panel, for example, as I'm a neuropathologist, so we do have a comprehensive panel, and we do have a basic NGS panel as well. So where all the alterations needed, for example, the IDH and the EGFR, etc., all done according to the NGS, yes.
So we have like 3 types of panels we are using. One is like
Thank you very much, Dr. Rawia Muhammad. We will be back very shortly for our next session. Thank you for the insight. We will be back very shortly for our next session, which is artificial intelligence and innovation in surgical pathology. So join us. It'll be probably about 5 minutes, and then Rawia will be back. So please remain in your seats if you'd like to stay, or join us if you weren't here for the first session. We will be back in just a moment.